Welcome to MBBS Council. In this video, we will see various medical course career options available along with course duration and tuition fees. If you are looking for MBBS or PG admission, install MBBS Council Android app. It contains everything you need to know to effectively participate in admission counseling and pick the best medical college for your NEET rank. Installation link for the app is given in the description below. Medical courses are available in 3 levels: undergraduate course with duration of 5.5 years, post-graduation course for 3 years, and super specialty course for 3 years. Medical courses are recognized or accredited by these 4 governing bodies: National Medical Commission (NMC), All India Institute of Medical Science (AIIMS), National Board of Examinations in Medical Science (NBE), College of Physicians and Surgeons (CPS). Let us first see the degree courses before moving to the diploma courses. The undergraduate medical course is MBBS. This course is available in government medical colleges, private medical colleges, and deemed university medical colleges. Tuition fees ranges from Rs 1,500 per year to Rs 60 lakhs per year, depending on the type of the medical college. There are 3 types of post-graduation courses: preclinical, paraclinical, and clinical. Clinical courses are again divided into medicine-related courses and surgery-related courses. Doctor of Medicine (MD) degree is awarded for courses related to medicine subjects. Master of Surgery (MS) degree is awarded for courses related to surgical subjects. Both MD and MS courses are conducted by government and private medical colleges across India. These courses are recognized by NMC. Tuition fees ranges between Rs 1,000 per year to Rs 70 lakhs per year, depending on the type of the medical college and course type. Let's see some postgraduate courses which are medicine related. General medicine, dermatology, radiodiagnosis, pediatrics, psychiatry are some of the examples. Courses which come under surgical branches are general surgery, ENT, obstetrics and gynecology, ophthalmology, orthopedics, etc. Except general medicine and general surgery, if you choose any other course, then that will become your end specialty, which means you would have very few options to choose during super specialty level courses. Post-graduation courses like general medicine and general surgery are called as broad specialty courses because you can specialize on oncology, cardiology, nephrology, neurology after completing the general medicine post-graduation course. Similarly, after completing general surgery course, one can specialize in cardiovascular surgery, plastic surgery, neurosurgery, urology, and so on. DNB courses, which are 3 years post-graduation course, are accredited by National Board of Examinations. These DNB courses are treated equal to MD or MS courses all over India. As DNB courses are conducted by hospitals, most of the courses will be on the clinical side. These courses are conducted by government as well as private hospitals. Tuition fees is Rs 1.5 lakhs per year and stipend per month would be close to 35,000. Then comes the FCPS Fellowship CPS courses, which are accredited by College of Physicians and Surgeons, Mumbai. These courses are recognized only in Maharashtra and few other states such as Gujarat, Madhya Pradesh, etc. After completing FCPS degree, you will be treated same as MD or MS only within the state where you completed that course. Moreover, DNB courses tuition fees is 1.5 lakhs per year, but FCPS course fees would be 7 lakhs per year to 24 lakhs per year, depending on the quota and the subject. Another disadvantage of FCPS course is that you may or may not get any stipend during the study period. After completing the MD course, one can do super specialty course DM, which means Doctorate of Medicine. Similarly, after completing MS course, one can do Master of Chirurgie MCH course. The equivalent of DNB course in super specialty is Doctorate of National Board DRNB. You can do any one of MD or MCH or DRNB course after completing the DNB course. There are 3 ways you can do diploma courses after completing MBBS. Diploma courses are conducted by medical colleges. DNB post-MBBS diploma courses are conducted by hospitals, and CPS diploma courses are conducted by colleges as well as hospitals. Course duration of diploma courses are 2 years. You will receive the same stipend as that of MD, MS or DNB residents in that particular college or hospital. After completing diploma course, one can complete postgraduate degree course by joining post-diploma DNB course for another 2 years. This course is also called as DNB secondary course. Similarly, FNB means Fellowship in National Board. This is a 2 years diploma course available at super specialty level. After completing super specialty course, one can do FNB postdoctoral course, FNB PD, which may be of 1 or 2 years duration depending on the course. Hope you got some clarity on medical courses by watching this video. If you find this video helpful, cheer us by clicking the thumbs up button. If you have any doubts regarding NEET admission counseling, comment below. See you in the next video.